Hi, my name's Matthew Links and I'm the Discipline Lead for Medicine at Bond University on the Gold Coast, which is on Kombumerri country. I'm a medical oncologist and a survivor of working in practice for the last 30 years. Today I want to share with you a structure for meditative and reflective practice called RAIN. This talk acts as an introduction to this series, Meditation for Medics, which explores the application of this framework to a variety of situations in clinical practice that can cause us stress. We all know that being a doctor or a medical student is stressful, and that the major cause of this stress are problems in the health system that we don't have a lot of control over as individuals. It's helpful to advocate for system change and to focus on things that are within our control. The two options are reducing demand or increasing our capacity. Mindfulness meditation has been put forward as one strategy to increase our capacity to cope with a system that's in crisis. Now, mindfulness-based stress reduction is an evidence-based strategy that works to reduce stress, and it can create a space for us to pause and deal with any underlying issues. But it doesn't solve them. Mindfulness helps us get to the next step, which is about changing the things within our control. Sometimes we can solve the problem, or we can bring new skills into the way we deal with it. One thing that can be powerful is to challenge and change the way we think about a problem. Whatever we do, there is a benefit to activating, diversifying, and reinforcing our self-care strategies. This structured meditation process shown here can help you develop a practice of doing this. The framework we'll use combines mindfulness, acceptance, critical inquiry, and self-care, and it's called RAIN. RAIN stands for recognition, acceptance, investigating, and nurturing. And after the RAIN, we want you to form an intention to act in a way that will reduce your stress. As we progress through this video, you'll be asked at each step to write a statement that summarizes your reflection. You may want to write them down, because at the end we're going to combine them into a mini meditation that you can do that would take maybe 30 seconds, and you can roll out whenever you need it. The strategy based on two evidence-based treatments for stress: mindfulness and acceptance and commitment therapy. Acceptance and commitment therapy combines elements of mindfulness, cognitive behavioral therapy, and commitment to change. The RAIN framework that we are proposing here can be used for dealing with multiple situations and emotions that are common in medical practice. Firstly, it's useful as a self-monitoring practice. Whether you're feeling sad because a patient has died or is doing badly, or to reflect on when a patient is doing really well or has good news. It can be used if you're feeling overwhelmed by the workload or ashamed because you made a mistake. It can also help you process frustration with colleagues or systems problem. It's a flexible system. Now, the first step in RAIN is recognition or noticing. And we want you to recognize both the good and the bad. Reinforce what works and replace what doesn't. Celebrate the wins and mourn the losses. The problem is that we're all busy and reflective practice tends to get squeezed out. Perhaps the best thing you can do to look after yourself is to ensure you allocate some time for a habit of reflection on how you're going. Now, acceptance, the second step, can be a difficult concept. If you're feeling depressed, that's not okay, you need to act. But in a sense, it is okay to feel down. It's okay not to be okay. We need to give ourselves permission to feel the way we do, and that's part of being kind to ourselves. We need to resolve the tension between allowing an emotional response and acting to promote our well-being. Beating ourselves up about how we're feeling shame or embarrassment, are a second type of injury and they're a barrier to getting help. Investigating how you're going can be tricky. Traditionally in mindfulness, thinking is not encouraged. There's a role for constructive investigation. We can all recognise when we're upset about thinking about a problem and when this can be unhelpful. It's easy to slip into rumination over an incident and go in circles. If this is happening, you need to stop and do the meditation trick of returning to a meditation anchor like your breath. Pause and focus on what is a helpful question. There are many types of investigation that are helpful. Further clarifying your feelings, identifying you're anxious when you think about an incident or your heart rate is racing. These are helpful observations. Thinking about how severe or persistent your reaction is gives you some guidance. Thinking about the cause of an incident is helpful, but it's most helpful if you can move beyond the immediate cause to the underlying cause. For example, let's say you made a medication error and you're upset. If you're ashamed, then the medication error might be the immediate cause, but the underlying cause might be related to the lack of sleep from the night before or the fact you were interrupted 3 times by your pager. Identifying the underlying cause leads to richer solutions. Understanding consequences is critical. If you're feeling a bit overwhelmed, understanding it's impacting on your sleep or you're becoming irritable at home are critical realizations. Investigating impact might reveal red flag symptoms that you indicate that you need urgent help, such as symptoms of depression, increasing errors or reliance on alcohol or drugs. Reflecting on how this event relates to your values is also really helpful. Identifying that your distress over a patient's suffering connects to your valuing compassion can help support you. And when it comes to choosing an action or a response, actions that align with your values are painful. Constructive investigation can also help suggest solutions. For example, I've been busy, haven't been exercising, I always get cranky when I don't exercise. I think I need to allocate time to go to the gym. The point for checking yourself for red flags deserves repeating. Sleep, eating, loss of interest, concentration, decision-making, non-attendance, increasing alcohol or drugs, low mood, increasing anxiety or irritability are all red flags. Be alert for these signs. You need to stop and seek help. And be aware that if your self-help strategies are not working, make time to get professional help. If in doubt, reach out. The next step is to nurture ourselves. And if you don't have a self-care plan, then you should get one. And if you have one, are you using it? Is it working? Do you need to reactivate it, diversify it? Is there anything you could learn that would reduce the stress and help you look after yourself? For example, conflict resolution skills or anger management, better time management. These might address underlying causes of stress. And if we're going to learn to look after ourselves, we need to prioritise learning these skills. And a great way of doing this is incorporating it into your self-care plan. So take a moment and create a nurturing statement. What are you going to do to look after yourself? And finally, a reflective practice sets a scene for improvement, but if you want things to change, you need to act differently. Set yourself an intention to change something. What you need to do more of or less of or differently. Having made an intention, think for a moment about what's going to make it happen. Are there any barriers or enablers? Do you need a reminder? I highly recommend learning a bit about how to make habits stick. Now make a commitment and hold yourself accountable. Now you can put all of this together and make a statement that is your reflection on each stages of RAIN. A recognition statement about how you're going. An allow or acceptance statement that it's okay to feel that way. An investigation statement that summarises what you found out about how you're going and causes, impact or consequences. And a commitment to nurture yourself with a specific strategy. This RAIN and intention statement can be a meditation you repeat through the day as often as you need to. It should only take 30 seconds. You draw on it whenever you need it. So in summary, medicine is stressful. A regular practice of mindful meditation can give you space to cope. The RAIN framework is a structure you can use to guide your reflection, recognising issues and allowing your emotional response are the first two steps. Constructive investigation digs deeper into significance, causes and effects and can lead to action. Understanding how to nurture yourself and making an intention to act are the final two steps. I hope you found this meditation helpful and that you can develop a reflective practice of looking after yourself. If you want to learn more about RAIN, Tara Brach has a fabulous website, Radical Compassion. Now, this introduction is part of a series. If you're interested, you can listen to episodes that deal with specific challenges. And of course, if you need to reach out for help, do. And there's a fabulous list of Australian resources on the AMSA AMA Traffic Light Guide site. Take care and thank you for committing this time to your well-being.